Thank you, Corinne, for the great support you and your staff have provided the officers and me throughout the past year. I thank all of you here tonight for your support and friendship throughout my time in this medical society, especially over this past year. I could not have achieved all that I have without the help of our physician members, delegates, my fellow officers, and our wonderful staff members. As I step down from my year as president, I look forward to enjoying the continued collegiality of the physician membership and the staff. I particularly need to thank my colleagues at the University of Massachusetts Medical School and my department, especially my chair, Dr. T.J. Fitzgerald, for their understanding and clinical coverage throughout my time as an officer. My daughter Jen and her new husband Stephen, and my sister-in-law Deborah and her husband Rick are here with us tonight. And my classmate from residency at Tufts, Kurt Studi, and his wife Pat flew up from Fort Worth to be here for the weekend. Thank you all for coming, for your love, friendship, and support over the years. And finally, I thank my wife Edie. Her wisdom, guidance, and support made the journey possible. Three years ago, when I asked the Committee on Nominations to support my candidacy, one of the questions was, what will the themes of your presidency be? I answered, I will focus on medical professionalism, patient-centered advocacy, and equitable physician-led care. 1 year ago, when I stood here and accepted the presidency, I shared those very same intentions with you. Well, you may have heard this Yiddish proverb, men plan and God laughs. Looking back on the last 12 months, I think I fulfilled my intentions, but perhaps not the way I thought I would. As many past presidents could tell you, you never know what will occupy your attention during the course of the year. History tells us it's smart to expect the unexpected. Our work can often be shaped in unexpected ways. I had concerns when I took office that a public health crisis could become the defining focus of my term as president. Ebola was already at the forefront of the news and was rapidly consuming the energies of the global medical community. This epidemic highlighted some of the inadequacies in our healthcare system to deal with such a highly communicable infectious disease threat. Fortunately, as we learned this morning, lessons were learned that have been incorporated into our emergency preparedness system, so we'll be ready for the next challenge. However, a second, very different epidemic also emerged onto the public stage during my watch, one for which there are no vaccines, no antibiotics, and no antivirals. In the past few years, this Commonwealth, like our nation, has been burdened by a series of individual tragedies, opioid overdoses. These sad losses have darkened many communities as they impacted families from the Cape to the Berkshires. In addition to these unintentional deaths, this opioid epidemic, as it has been labeled, has placed a burden on the Commonwealth's healthcare system. Thousands of emergency department visits and hospital admissions have been related to non-fatal overdoses. As our elected leaders have struggled to address this issue, there has been an important discussion over whether opioid prescriptions might be a factor in this tragedy. Certainly, there's no way that the Nominations Committee could have known in the spring of 2012 that this would be the defining issue of my past year. They also could not have known that it would be helpful to have a president who is an oncologist specializing in palliative care, as we tried to answer the question public health officials ask, is there anything that physicians can do to help? We are making inroads on this latest epidemic. It has complex roots and will require complex solutions. We have been meeting with state and federal officials to advocate for a multi-pronged approach that continues to address pain management needs while fighting the epidemic. So as I reflect on this past year, it occurs to me that maybe, after all, my year really was about professionalism, physician leadership, and patient-centered care. As with so many urgent problems, physicians must strike a careful balance. We have a sacred duty to advocate and care for our patients, and we have a responsibility to be leaders and citizens of this Commonwealth. One cannot be separated from the other. In our thinking, our actions, we employ science and experience, data and intuition, our head and our heart. This tension and this dynamic defines us as physicians. It's why we have a seat at the table, and it's often the source of our effectiveness. This is what medical professionalism, physician leadership, and patient-centered care is all about. It has been a high point of my career to be the voice of my physician colleagues who toil every day to serve the patients who depend on them. When I'm asked to talk with public officials or the media about serious issues, such as opioid abuse, I think of my colleagues who are on the front lines dealing with these difficult problems every day. In short, your dedication, your perseverance, and your professionalism has always been a source of inspiration that made it easy to speak up, to have a stronger voice. What can I say? I am incredibly proud of this organization. As I begin to close, I'd like to shift gears briefly to touch on a lighter topic. Finally, after 17 years of hard work, you and your colleagues from across the nation did everything necessary to pass Medicare payment reform. When everyone said that there would never again be bipartisan legislation coming from Capitol Hill, you ignored the cynics and kept pushing for change. And we succeeded. You make an enormous difference, not just this year, but every year. From the State House to Washington, to the breakthrough research in our incredible medical journal, to the introduction of Knowledge Plus, which could define the future of medical education. This year has been an incredible personal experience. For this honor, this privilege, and the opportunity to serve, I thank you all so very much. Thank you.